All right, well, we don't want to take away time, so we'll get started. Thank you everyone for joining, and if you have questions along the way, as Dr. Taffe is presenting, please put them in the chat and we will get to them all as best as we can. So thank you for that. So with that announcement, it is my absolute pleasure to introduce Dr. Taffe. Dr. Taffe and I go a long ways back. I will give a little historical context in a minute. But before that, a little biographical. So Dr. Taffe earned his master's and PhD at the University of California, San Diego, before then doing a postdoc at Scripps Research Institute, and then moved up into the ranks as assistant and associate professor there. And in 2019, he moved to his current position in the Department of Psychiatry and Skaggs School of Pharmacology at UC San Diego. So back to his starting place with his PhD and master's work. If you look at his record, he has a very extensive publication record. Very successful NIH funded researcher. And in my opinion, I think he is one of the absolute best behavioral pharmacologists in the field, period, bar none. If you look at his volume of work, you know, his first R01 that I could track down was on the neuropharmacology of primate cognition, to the most recent work on bath salts, dissecting the abuse liability of synthetic cathinone stimulants. He has worked in all kinds of model systems, primate, rodent, and more recently, lobster and crayfish. I was thrilled to serve as the action editor for a special issue when he put in his crayfish work, introducing a new ethanol model to the field. I think it's going to be very impactful and profound, along with his other work that's already been quite impactful. He also has very extensive NIH grant review history, and that's actually where I first met Mike. It was in the BRLE study section. BRLE, in my words, is the sort of catch-all of where else do grants go if they can't go anywhere else, is to biobehavior regulation, learning, and ethology study section. It was in 2006 that we met. And I actually, to this day, remember the first words Mike ever spoke to me. We were in disagreement about a review. And I actually also know the person whose review we were doing, who's been wildly successful now and is doing great in the career. But it was at that moment that I started to learn so much from Mike about just sort of thinking about reviews, thinking about being fair, thinking about being equitable, thinking about what matters and doesn't matter when you're doing these reviews. I've been lucky to be able to learn from him for 16 years, but more so I've been lucky to have and call him a friend for 16 years. So thank you for that, Mike. So I want everybody to join me in thanking Dr. Taffe for joining us here and his willingness to help us have some of these important conversations about review and grant funding and racial inequities in NIH funding. So with that, I'm going to turn it over to you, Dr. Taffe. Thank you very much for helping us with this topic.
Thanks for that introduction, Rick. And I swear we didn't collaborate on what was going to be my my first slide. So you do indeed meet the best people on study section. And Rick already said this, but I want to just acknowledge that this feeling is mutual, that I thought that after getting, over being intimidated by his expertise scientifically, I do want to thank Rick for many insights on proposals, how they should be reviewed equitably, certainly a lot about what is quality behavioral science. And as he kind of alluded to, mostly the side conversations we would have about careers in science. So thank you for inviting me, and thanks for a long history of friendship and collegiality. Okay, so the first takeaway message is that the funding is the science. In biomedical disciplines, particularly in the United States, what gets done is that which gets funded. And primarily that means NIH in my world, although there'll be some parallels in other funding systems. My goals are threefold today. To do a general education on a funding disparity that's been identified that leaves Black investigator applications at a disadvantage. I want to discuss some issues that have come more recently in these papers from the NIH about the implications for topic diversity and maybe touch on substance abuse a little bit. And then finally, I want to touch on issues for diversity hiring that have been very much at the forefront of many universities in the past couple of years, including at the University of Nebraska. And so some of this stuff is easily Googled, but suffice it to say that much like many faculties across this country, about low single digits, 2%, 3% of faculty are Black. Even in Nebraska, I was interested to see with a 4.8% Black population. And of course, that's in the background of a 14% US population background. We have a diversity issue. You can also Google up, not just in Nebraska, but other universities, various statements on what they plan to do about diversity and diversity hiring. And you can see things like a statement that they exhort people in the university to identify best practices in recruitment and retention. And I'll be touching on these issues today. There's another statement and something else that said, know the data and be intentional. And hopefully some of these remarks I have will help doing that. I do want to start off with a very important point is that, I will be talking about things that have to do with both equity for individuals, so individual professors primarily, individual scientists, and I'll be talking about diversity for institutions, universities certainly, but also other institutional structures. And this talk is going to have a tendency to conflate the two. Given that, it's important to suggest that this is not meant to imply, this conflation is not meant to imply that the only value of equity for an individual is the degree to which that gives service to the institution. Those are separable goods and separable issues. And I think it's, we can kind of walk and chew gum at the same time, even if I have a tendency to conflate these matters. All right, the real big picture of today's talk is that our efforts to diversify our universities are going to fail miserably if we don't do something about the Ginther gap. So what is the Ginther gap? And before I get to that, I want to point out that a year ago now, when President Biden first came into office, he exhorted by matter of an executive order that the federal government should have a comprehensive approach to advancing equity, that he directed his administration basically to determine whether the various agencies and actions exacerbated barriers to full and equal participation by all individuals. And specifically, he tasked the heads of each agency to conduct a review to try to determine whether underserved communities and their members face systemic barriers in accessing the benefits and opportunities under each of those individual agencies. Now, fortunately for the National Institutes of Health, which funds a great deal of extramural research in this country, including at University of Nebraska, they'd already kind of conducted this review. So in 2011, over 10 years ago, Donna Ginther and colleagues published this paper in Science, which showed that those grant proposals that had African-American principal investigators were less likely to be funded. There were a number of follow-up papers with the various aspects of this. And one of the more important things that happened is in 2019, Travis Hoppe and colleagues published a follow-up with a different sample, a more recent sample of grants showing that there was still this disparity, despite all the nice talk that followed the 2011 report. This is from the original paper in 2011. This is the first figure, just showing that 4 Research 1 grants, RO1 grants, submitted for possible funding between 2000 and 2006 to the NIH. If the application had a white PI, about 29% of those were being funded, and considerably fewer were being funded. 17% of them were being funded if they happen to have a Black PI. There's a reduction for Asian PIs as well, and this amounted to about 58% of the chance for Black PI applications, or a 1.7-fold advantage for those applications that had white PIs. As I mentioned, in 2019, there was a follow-up with, again, RO1 application success rates. These ones submitted from 2011 to 2015, just skipping forward in time. Many of you know, to your great dismay, that the overall success rates of the NIH had fallen considerably in this time. So if an application had a white PI, 17.7% of them were being funded, and only 10.7% of them were being funded if they happen to have a Black PI, amounting to about 60% of the chance or a 1.7-fold advantage for the white PI applications. This is about as perfect a replication as you can get. So I won't belabor a lot of that, but one of the things I've been thinking about more recently is, that's all fine and good, but what about the brain institutes? What about the things that I'm interested in? What about the things that are most important in science? Maybe it's the case that those bad people over at the Cancer Institute are doing terrible things, but everybody else is good. And in the ensuing, over a decade, mostly NIH's response to this kind of, further inquiry into their practices has been to shrug and not really be that interested in whether or not, at least publicly speaking, whether or not these trends are reflected in each and every one of the funding institutes. I'm sorry, I should have mentioned, this is just a ranking of fiscal year 2020 allocations in millions of dollars and the percentage of the budget that's allocated to each of the institutes and centers. And so the brain ones are kind of sprinkled throughout here, and they amount to quite a bit of funding. And the substance abuse ones, which I didn't highlight, but NIAAA, NIDA, and indeed the Cancer Institute has some funding. So there's a substantial amount of the budget. So we're very interested in if this translates. Well, fortunately, through some advocacy of various people, including myself, some of the directors have been good enough to try to commission reports of their own institutes or centers. So this is a report from George Koob at the NIAAA, the Alcohol Institute. He presented those last summer at a meeting and showed that for research projects grants submitted to his agency 2010 to 2020, there was this same gap. So over here, you see that if an application had a white PI, it was 21% likely to be funded, and if it had a black PI, it was 12%. This amounts to about 57% of the chance, or 11.75-fold advantage for the white PI application. So a pretty good reflection of the NIH aggregate at NIAAA. Josh Gordon at National Institute of Mental Health has similarly posted an analysis on a blog post. And here he rounded up just about everything you can conceivably think about in research grant funding from 2008 to 2019 from mental health. And this analysis broke it down by those applications that had at least one black PI, because now there's multi-PI, and those that had none. And so what the overall take-home message here was that there was a 15% chance of being funded if that application had no black PIs, and a 9.3% chance of being funded if they did, which worked out to be about 61% of the chance. The black PI applications are a 1.6-fold advantage if there was no black PI. So again, a fairly decent reflection for this medium to large institute of the aggregate NIH stats. And one important thing that comes up in this is that I'm going to point out, because he did this analysis, is what about those applications that don't score very well and probably wouldn't be funded, but get picked up by exception pay, or pickups as we call them. And that they sort of operationalized by looking at those with voted impact scores of 35 or above, of which 3% of them got picked up for funding if they had a black PI, and 6%, or twice as many, twice as high a percentage, got picked up for funding if they had no black PI. And I want to point out that because of the difference in the numbers of applications being submitted by black PIs, which is low, kind of 2%-ish levels for most institutes and centers, you're talking about picking up 7 grants versus 493 grants at very poor impact scores. Now, one of the reasons I've been sort of advocating for this kind of an analysis at the IC level is because if there happens to be an IC that is doing better than average, perhaps we can learn something from what they are doing. And we finally have one of those. So NIDA has finally presented some data for fiscal year 2020 only. This was presented at an advisory council last month. And what they showed is that there is no disparity. And so applications are research project grants, 21% likely to be funded if they have a black PI, 18.7% likely to be funded if they have a white PI, so no gap. Aha. Now, of course, there was the exception pay thing, and of course they were doing better here too, but this amounts to 5 versus 110 grants. That's not explaining the overall lack of difference, if that's what you're interested in. We don't know much about this data set yet, and so like I said, I think that I've always thought that if we could identify one of the institutes or centers that happens to be doing better, or a topic domain or something, we should be looking into that to find out what practices can be extended to the rest of the NIH. Okay, I'm going to move a little bit from the individual to a little more systemic question now. So one of the things in the Hoppe et al. Paper was not just the replication, but the fact that they looked into the topics. And so they did this sort of, informatics word scraping approach to try to group applications into topic domains based on their content. They come up with 150 clusters of applications based on content, and they could rank those based on how likely they were to be awarded funding within those topics. They found that 37.5% of applications that had Black PIs mapped to only 8 of these 150 topic clusters, and of those 8, 6 of them had award rates that were significantly below the NIH average. Aha, they said. It's just that these applications are coming in the wrong, quote unquote, topics. Now, one thing they didn't emphasize, they didn't admit, but they didn't emphasize is that regardless of how successful a topic was, white applications were advantaged. And so if you I regraphed now data that was kind of hidden in a table in supplement figure S6 of this report. And what this is, it's a representation of these 150 clusters ranked on funding success here and broken down into quintiles. So because the vast majority of the applications are indeed have white applicants, that drives the trend here, which of course is perfectly linear, with some more successful and some less successful topic clusters. What you see is across these quintiles, success rates for African-American PI applications are still poorer, and even the very best one, that disparity is quite large. So, NIH would like to have gone on about how the fact that they've explained this 20% of this gap with topic choice, but they really kind of undersell the idea that, well, they really only explained 20% and at least 80% of the gap unexplained by topic. To give you some flavor for why it's going to be a little frustrating to sort of directly look into this word cluster analysis and try to figure out, sort of something very practical about the kinds of applications. These are, not necessarily that intuitive. So the top are the examples from that paper of clusters that enjoyed above average success rates in the upper 20s, those that had below average in the 10 to 11 to 12% funding range. And you sort of can go through and look for different topics, but it's not at all necessarily obvious. I mean, yes, you do occasionally see things like racial minority African Americans. You do see things like substance abuse and mental health and adolescence here, but it's not a sort of one-to-one mapping of your most obvious ideas. So do keep that in mind, that it's a subtle statistical thing. So to draw back a little more to the systemic problem, now we have this implication that if topics that are of disproportionate interest to Black investigators, who again are only about 2% of overall applicants, if they map onto the topics that are of interest to African Americans, the general population, which is 14% of the population in the US, we got a problem of systemic health disparity, right? So research on the health concerns of tax-paying people of color is less common, reduces identification, detection, remediation, cures, et cetera, for this population. And that's a huge systemic problem. And indeed, that supposition is true. And so Mike Lauer, who's the head of the Office of Extramural Research in charge of the grants at NIH, has published this paper in eLife. It started off as a blog post, turned into a preprint. But he said, look, the institutes and centers have varying success rates. So here he's showing that award rates at some of these is very low at 9%. If you happen to be applying to the Eye Institute, you enjoy a 27% success rate. So go into eye research. And there's a span. And so what they found is that if they looked at the institutes and centers that received a higher than average proportion of the Black applications, and those are these ones here, they have a lower award rate probability than the NIH average, which is around here somewhere. Aha. Those silly African-American investigators just applying to the wrong institutes for funding. And indeed, these 5 received 35% of the applicants, Black applicants, but only 19% overall. So again, it's a statistical probability, it's not an inevitability. Well, they kind of undersold the idea that with the phrase of art called the funding ecology, as if it was some independent thing, Lauer begged off on. Without reflecting that the allocation of dollars to NIH institutes and centers varies tremendously from 15.5% to 0.2 and 0.8% down here. Of course, I'm identifying the ones that were in these disproportionate clusters here, and they range from very low to, this is not terrible at NIAID. But this gets us from sort of identification to action items. What can we do? What should we do? What do we need to know? One of the questions to ask is if this is true, if these topics of interest to Black PIs are being less well funded. First of all, as my co-author on some opinion pieces, Nick Gilpin, pointed out, excusing this as a funding ecology is really underselling the idea to which this is the very definition of systemic racism. If you're having less dollars allocated to the interests of a particular segment of the applicant population, it really begs the question of why these ICs are not better funded. Why are they not equalizing success rates across institutes and centers? When it comes to a couple of the institutes and centers that are particularly of high interest to the African-American applicant population and are have particularly low success rates and low percentages of the budget, nursing research and particularly minority health and health disparities, you wonder why are these grants being assigned there? So particularly for minority health and health disparities, you might think that they cover a vast range of topics, ranging from cancer, which would be covered by NCI, to NIDA, drug abuse, NIAAA, et cetera, that have much greater percentages of the budget. All right. This could be a little bit rude, but if you go snooping on Reporter for things like what kinds of grants are being funded at the National Institute on Minority Health and Health Disparities, and you can find a grant, and you can go and do things like search out that PI's other grants, and you can look at the descriptions, the abstracts of those grants, and you find out that they are just about the same science, with a single exception of the target population. That's one there. Found another one that is actually a drug abuse related topic. Again, same PI. You look at the science that's described in the abstract. It's the exact same science with the exception of the target population. Here's another one, tobacco related. I know it's important in your community, in your research group. Here's a study on tobacco disparities, and of course, this particular individual has not one but two R01s on very similar topics from the best funded institute and center, that would be the Cancer Institute. Okay, so that's a place to start asking new questions. Does this bias really matter? It matters in a number of ways. So what about, is it important that some topics are disadvantaged? I'm going to tell you a little tiny story. This is sort of addresses this. So I do some work on e-cigarettes. In 2020, the FDA sprung into action, I say that sarcastically, and finally banned flavorants from e-cigarette juices because they hypothesized that the candy flavors were appealing to children. They left menthol unaffected. And we're having another round of discussion about should we ban menthol from cigarette products today in the news. Well, if you do a simple Google search for marketing materials for Marlboro, which is not a menthol brand of cigarettes, you'll see ads like this. If you do a Google search for Kool, which is a menthol brand, you'll see ads like this. It's a striking increase in African-American faces, which most of you know. And there's actually science on this, right? So there's epidemiology suggesting that there are magazines that are targeted to Black readers, and those tend to be dominated by menthol brand cigarettes ads. And you can see additional research on marketing at the convenience store level. There's a little bit more in terms of smoking epidemiology. There's a research on the fact that African-American youth have actually lower smoking rates. They initiate smoking at older ages, which is a protective factor, as we know. Smoking frequency and intensity tends to be lower once somebody is smoking in African-American populations, both youth and adult, but morbidity and mortality rates are higher. And then finally, this needs a lot more work, but there's some recent evidence that there's a possibly a genetic association with this. And so is the study that showed that a 5 to 8-fold increase in the odds of menthol cigarette smoking associated with a gene variant that's present only in people of African descent. It gets even deeper than this in terms of the science, right? So there is a mechanistic explanation or a mechanistic avenue, I should say, for research. So Brandon Henderson, who's at the Marshall University, when he was a postdoc, he did some studies working on menthol, showing that menthol itself upregulated nicotinic acetylcholine receptor expression. It had effect on dopaminergic neurons, spontaneous firing rates. And he showed that not only it had an effect by itself, but it interacted with the effects of nicotine to do both those things. In his faculty job, he's been focusing on e-cigarette things and other flavorants. So in this case, green apple flavorant, and identified a chemical called farnesol, which, what do you know, alters the expression of nicotinic acetylcholine receptors, dopaminergic and GABA neuron firing, and it interacts with nicotine, and he's even shown some behavioral effects. This is a self-administration of nicotine vapor or a vapor in mice, showing that under a PR schedule, they will, self-administer more nicotine. They will the vehicle that's used. They will self-administer the green apple flavorant itself. You put them together, they take more. They don't tend to self-administer menthol vapor by itself, but you put it together with nicotine, they take more than they do with nicotine alone. So there's a science here, right? And I don't mean to suggest that just because Brandon's Black and is interested in these things, and indeed me, Addie, who's another contributor to this, happens to be Black, and because I have interest in this and I'm Black. I'm not suggesting that you have to be Black to be interested in these topics. What I'm suggesting is that people have things they're interested in. And some of that stuff is well-funded, and some of that stuff is not well-funded. Things may not be all fine and dandy at NIDA, but this it looked pretty good, the overall aggregate success rate, but they actually had another slide in their presentation from Dr. Avila that sort of got us on to, harkens back to this Lauer data, which is that there are three major divisions of funding at NIDA, one for epidemiological services and prevention, one for neuroscience, and one for therapeutics and medical consequences. And what he showed is that there was a sort of disproportionate preference of those African-American applications for the epidemiological services and prevention research division. And he didn't provide any breakdown of the success rates, but the point is this goes back to that kind of funding ecology and where the overall budget is being allocated. And if it is the case, that what's happening here is that the relative amount of funding within NIDA to these divisions is in better match with their applicants on various topics. That could be the reason. It could be just, it could be an avenue to pursue at the NIH level. I just said that. Unfortunately, I tried to look into a little bit of rural drug use and Native American drug use and thinking about some of the things that are of greatest interest to your center. I did this sort of search of National Institute on Minority Health and Health Disparities versus what NIDA was funding. And actually, in this case, at least for funded projects, this is not for success rates because I can only have access to the funded projects. 18 from NIMHD, 174 by NIDA, this ratio 11 to 58. That's a pretty good approximation of the relative dollar funding to those two institutes. So it's worth asking questions about, but we're not always going to find that there's an answer there. Okay. I'm going to cycle back a little bit more to the individual level for just a second, but it intersects with a systemic issue. Is it important that Black professors are disadvantaged in securing grant funds? Well, to remind you, I started off with this suggestion that your institution wants to hire for diversity and to generate best practices to both recruit and to retain. While this retention issue interacts, at least in the biomedical science disciplines, with this grant funding issue. So you're not alone in this, but NIH grants matter for tenure, basically. So here in your description of criteria for getting tenure, the person has to have a record of scholarly creative work, includes research. This one's fairly non-specific and can be funded, in a variety of ways. But interestingly, if a new assistant professor clicks through onto these samples of research statements that are going to get them tenure, what you see is there's one that's called in the sciences, and this person says their research is supported by the NSF dollar figure by the NSF dollar figure. In the social sciences example, this person says, I got grants from the NIH with this amount of money, goes on to detail NIH, their grant application vigor and participation. And this is by no means isolated to University of Nebraska. So my department has criteria for tenure that sound very much the same, only maybe a little bit more pointed. At the fourth year review, they're supposed to be starting to get active research grant support. They have to maintain publication productivity and develop an independent research program. This is underlined at the tenure bar itself. And it's very hard in the biomedical disciplines and in psychiatry in particular to understand how any of this could happen without significant research grant funding. So it's very important to have grant funding. Interestingly, and keep your eyes out for these things are hidden everywhere. So if anyone wants to accelerate, to do better than average, right? So we're not just talking about survival, we're talking about if somebody wants to be one of those hard charges at the front of the envelope, they have to have exceptional research grant productivity and research grants specifically said. So having a lot of grants gets you accelerating your career. And there are things buried everywhere. So one of the things that's said in one of our documents is that if you want to be credited for this acceleration in the service area as well, if you get unusually early appointment to a prestigious society such as the ACMP, and if you go on the web and you look at the criteria for membership in the ACMP, having a research grant is one of those criteria. So these links to grant success are buried everywhere in academia. And by buried, I do not mean hidden. I mean, they're very obvious, but they're just an entrenched part of our system. And so you can flip through, you can Google, the criteria for tenure, just about any university, you can find it. And you will see that obtaining major funding, often specified as a research grant from the NIH, is a requirement for tenure. And furthermore, that sustained pattern of funding is basically an expectation for all the way through full professors. So given that it matters, what does it take? So this is important. In a practical matter, we can want things to change to get better, but what does it take? When I was a young, naive assistant professor, I started at the Scripps Research Institute in a soft money job. All I had to do was write grants, basically. I thought, well, if the aggregate success rate is about 20%, I put in 5, I have a fighting chance. Some of you will recognize that I'm math challenged, and I also did not want to face reality. So reality is the cumulative probability of one hit, given the number of lottery tickets you buy. In the parlance of NIH grant funding, if we start with these success rates identified in Hoppe et al., what you see is that to build up to a cumulative probability of award north of 80%, and again, that's no guarantee, right? That's just a probability. That requires something like 10 applications if you start off with this advantaged success rate, and 8 more, or 18, if you're this disadvantaged success rate. 18, those are a lot of grant proposals. Most of you know grant proposals in the NIH go in 3 times a year. Mostly the way revisions work, you can only can skip a cycle, and more importantly, those things do not just write themselves. Each individual application requires supporting preliminary data. And so it's not trivial to just write 4 more, 8 more applications that have the same cumulative probability of success from a statistical standpoint. This brings us back to additional comments. So this I found was a memo from your executive vice chancellor on promotion and tenure, and saying that every tenure promotion decision should be judged against the same standards. Sounds great, right? Well, what does that mean? Does that mean just getting a grant is the same standard? When getting that grant, the probability of getting that grant is vastly different for different people at that institution. Is that fair? Is that equitable? They judge against the same standard? You can see these little cartoons everywhere. I'm increasingly grumpy with this, which is why I didn't show it. But basically it shows that when you talk about judging against the same standard, are you trying to evaluate people who are in a hole versus people who are already tremendously advantaged? Or do you have true equality, which is that these kind of standards, these kind of statements tend to assume? Okay, so it's very clear. The message of this talk is very clear. If you're involved in diversity hiring at your institution, you need to recognize that if you're going to hire Black assistant professors in the biomedical sciences, they need more time to write proposals, to revise and submit proposals. They need more startup money to devote to preliminary studies to support those additional proposals. They might need more trainee help. So some places that's program support, T32, CERT programs, whatever it might be. They need more people to generate those preliminary studies. And ultimately, this boils down to runway. They need more runway to sustain initial laboratory growth for extra years even. I didn't talk about this aspect of the studies quite so much, but one thing that's very helpful and one thing that's buried in one of the Ginther reports is an idea that you need to really help establish non-exploitative collaboration with established faculty. So, not just hire somebody that's got a new technique and collaborate with them because you want their technique, but you need to collaborate in a way that's going to lead to their success, their individual success. This is a tough one, and I was just talking about this. So this recognition that there is not a level playing field and that there is not the same chance of getting a research grant. If getting that research grant is such a criterion for tenure, and people have what amount to possibly a year's worth of difference, years, plural, worth of difference in their, reaching a target probability of getting a research grant, the clock is ticking when it comes to tenure. And so I think it's very important, going forward for promotion committees at the university level to start figuring out how really to grapple with this disparity of opportunity for their young faculty. And, there are many aspects of the Ginther publications and the Hoppe publications showing that this disparity is still present, no matter if they're full professors, if they have grant experience, if they've served on grant panels. Hoppe et al. Showed that it exists in all topic domains, even the ones that are the sort of most fundable ones. And so, there's basically very little chance to escape this problem. Usually about this time of this education process, we get to the what can we do, and people are very well intentioned, and I usually give a little bit of pablum about educating yourself is what we're doing today, and maybe complaining to your society journals or writing pieces, which many people have done, talking to NIH staff directly. But ultimately, we are over 10 years into this the identification of this problem. That is some 31, 32 council rounds, funding rounds at the NIH, and nothing's been done. So, ultimately the biggest impact on grant funding is peer review. Now, I do want to caution that this is not about Snidely Whiplash, right? So right from the very top, it was clear that going after overt racists as the problem was the wrong way to go. Now, this is very popular, and this was an initial, there's a lot of aspects of what NIH was trying to do that are basically predicated on this. This is a death of 1,000 cuts, right? It is not one person making decisions. It's not even a handful of people making decisions. It's a system. And, nobody's free of implicit bias. We have a lot of implicit bias training that shows that that it's not about well-intentioned individuals. It may not have anything to do with the color of a person's skin is making those decisions. Now, what it is about is the fact that when we as peers operate in good faith within systems that are unjust, we're perpetuating that injustice. Like I said, we're 10 years post-Ginther. We had a replication in Hoppe. We've had confirmation at the individual IC level for those places we've been able to get data from. I didn't mention this, but back in October, there was some pushback from the Office of Director of the NIH level against NINDS, NIDA, and NIAAA. We're trying to take little tiny baby steps to try to get basically just more information about who is applying to their institutes. And so ultimately, our inaction on this is taking an action, is my point. So because it's a systemic problem, I like to think about, and as Rick kind of alluded to at the very top when introducing to me, I like to think about the systemic issues of what we're doing with grant review and peer review. And I think systemic problems need to be addressed with systemic solutions. So, one of the core things I've come to is this concept of the inherent conservatism of NIH grant review, by which I mean that you basically have to have already gotten an R01 in order to review subsequent R01s. And so this initial peer review is being conducted by people who have been selected by the system as being congruent with the system. They're being beaten into the form by hard experience in some cases. And you end up with people who have similar interests and approaches as prior reviewers being the reviewers of any subsequent grants. And that's inherently cyclically conservative. This ties into the idea that review is, when it really comes down to it, subjective, right? Good scores are given to those topics that are of interest to that reviewer. They find it to be significant and interesting. It's using methods and approaches that they personally approve of, understand, and think are great. And of course, we all know that there's a tremendous diversity of opinion. There's no such thing as an objective approach to significance or to, a lot of research grant approaches in our fields, it's different. And of course, there's grant smithing, is it written in the right way? Because of this inherent conservatism, I think even though we have these panel selection rules for diversity in geography, zip code, science topic, race, whatever, they can't really overcome this inherent conservative trend. And, to make it very practical, only about 2% of reviewers are Black, and CSR has no intention of targeting higher than that. That's not even one reviewer per study section panel. And even one reviewer cannot possibly provide balance, even if you get past this inherently conservative selection idea. So on a personal basis, I mean, I think one of the big takeaway messages here is that we need to stop reviewing significance on the basis of what's interest to us as peer reviewers. You really have to try to cast that aside and try to figure out what is the applicant, what's the application saying about what's significant to them and their interests. There are some technical fixes, right? So one of the first things you learn when you start on study section is this mantra about the burden of triage cannot fall on. So triage is the system by which half the applications are they're ranked prior to the meeting, the study section meeting, and about half of them are not discussed, which is a pretty bad outcome. They can't really be picked up for exception pay funding. It's bad. And so there's been this mantra that we can't sort of prioritize R01s over smaller applications like R21s and R03s. You can't like triage all the R21s. You can discuss a few more R01s. And importantly, for early stage investigator applications, this came down a number of years ago, I think while Rick and I were on study section together. But we can't sort of punish all the young people's apps to prioritize the established people's apps. Well, this is a technical fix, right? So the papers have shown that applications of Black PIs are 1.5 times more likely to be triaged. Simple fix, right? The burden of triage shouldn't fall on those applications. We need to abandon this conceit that NIH has, for obvious reasons, having to do with, you know, arguing to Congress, that only the most meritorious applications can be funded, because source. And this was a beat-all study too, where there was something buried deep in that showed that in this case, it was the 35 percentile applications or higher, of which about 119 were funded with white PIs, and 0 were funded with Black PIs at this percentile. And so you had this huge bulk of applications, which amounts to about half again as many as were funded altogether with Black PIs. They were being funded these poor priority scores, right? So the idea that the review is this meritorious reflection on the most meritorious application of funded is total nonsense. Those can be addressed. I'm about wrapping up here, so we get to questions. But you know, ultimately there have been a number of commentaries and opinions, and you can Google these up or PubMed these up. But there's a good one from a bunch of biomedical engineers that made a call for action about these topics. The NIH. My paper with my op-ed, I guess, with Nick Gilpin is in eLife, and that summarizes an awful lot of these topics. And there have been a number of other ones. Okay, so I'm going to end there so we can have some questions, but thank you for attending. Thank you for inviting me, Rick. I'm happy to entertain your thoughts.